Good afternoon and welcome to the Livewire, UNC Charlotte's forum for conversations with newsmakers from here on campus and beyond. I'm Will City. Each year, an estimated 3.8 million people suffer a concussion as a result of a sport or physical activity, and there's evidence those numbers are on the rise. Data from ER visits showed a 62% increase in patients seeking treatment for concussions from 2001 to 2009. While in past years the seriousness of the injury may not have been fully understood, concussions' prevalence in the NFL and their effects on current and former players has drawn public attention to the issue. The front lines of efforts to deal with sports-related concussions are often held by athletic trainers. With us today on the Livewire is UNC Charlotte Athletic Training Clinical Coordinator Brett Wood to explain why one of the most dangerous injuries athletes face can also be one of the most complex for trainers to diagnose and manage. Brett, thank you so much for joining us today.
Oh, thank you. It's my pleasure.
Now let's start off as a baseline. Explain to me what physically happens to someone when they suffer a concussion.
Well, what occurs is the brain is obviously smaller than the cavity which it exists within. So when one is struck either in the head or in the chest and the head moves, the brain moves within the skull cavity. And as it moves within the skull cavity, there is what we would call micro or cellular damage, not necessarily a gross damage to the brain as we would think with true cerebral bleeding problems, but rather at the cellular level. So essentially the brain gets, in a simplified way, sloshed. It gets moved, and this movement causes a complex cellular change within the brain.
So the literature refers to concussions as a mild traumatic brain injury. Now obviously that sounds pretty serious. And that's a little bit of a contrast from what you might have heard head injuries described as the past as a dinger, got their bell rung. How has the evolution of the vocabulary changed the way people look at concussions?
Well, that's a really good point. One of the thoughts and one of the things we're trying to overcome right now is that concussions are serious brain injuries. They are mild, but they are traumatic, and there are problems that come along with it. So historically we've thought of these brain injuries as being very simplistic and very easily overcome and not a big deal. So we've given them names such as dingers and bell rung and seeing birds or whatever you want to say. So we've tried to change that conversation a little bit to help those who are involved with sport to understand that it is more than just a simplistic problem. It is a brain injury, and brain injuries are serious injuries.
Now, education isn't the first thing that would come to mind when you think about the job of an athletic trainer, but is that part of the profession?
It is. One of the things we have to do is certainly educate the public about these issues and about these things, but mostly we have to educate the people that we work most closely with, and those would be the coaches and the athletes and the parents of these athletes, to inform them of the conditions that they will face and the seriousness of those problems. So education is a large part of what we have to do.
Now, on the note of conversations with coaches and administrators and parents, how far does a well-articulated organizational policy about concussions go towards making sure these are treated the way they should be?
It's significant. It's very significant. One of the things that has changed over the last few years is having organizational policies related to concussion. Previously, if you were at X institution, the way they would handle a concussion might be totally different than if you were at Y institution. If you were in the NFL and how you handle a concussion might be totally different than if you were in NCAA football, how you might handle a concussion, or if you were dealing with soccer players, how you might handle a concussion versus dealing with football players. So one of the things that's happened in just about all levels of sports, not totally in youth sport, but in high-level sport, let's say professional sport, whether that be football, basketball, baseball, or high-level sport, let's say collegiate sport, the institutions that control the sport have created rules and policies about management. And as it's created these rules and policies, it's made uniform treatment it's not totally there, but we're getting close to making management much more uniform than it has been in the past.
Some of the major athletic training organizations at the national level have recommended that a trainer be on site at any organized competition. Do you agree with that recommendation, and why is that important?
Yeah, totally. That's one of the things that, as an athletic trainer, the message that we try to put out. One of the keys to managing concussion, we won't eliminate concussions, but one of the keys is to have someone who's qualified on site who recognizes a concussion, who shouldn't have a conflict of interest in management of concussion. And so as athletic trainers, that's our job and that's our role. We find at the higher levels that athletic trainers are on site, and they do exist and they are there. One of the messages we're trying to put out, though, is that not only high-level athletes get concussed, but high school athletes get concussed, and junior high and middle school and recreational kids get concussed as well. So we're trying to put out the message that if you're going to conduct sport, that you should have someone there, a healthcare provider who's there, who's trained and qualified to recognize not only concussion, but a lot of different injuries. But having a qualified professional and having an athletic trainer is one of the messages we try to put out daily, especially to the high schools.
Now, in addition to being that unbiased source that can possibly step in if a coach or administrator is pushing the limit of whether someone should go in or not, athletic trainers are also valuable because they can look out for people who might not know they are concussed, because underreporting or unreported concussions are a big problem, right?
That's correct. And some of it has to do with sport culture. Some athletes don't understand what a concussion is, so some athletes believe if they weren't knocked out, they weren't concussed. And there's a motivation for athletes to hide concussion. Most athletes are highly competitive and they want to participate and they want to play, and they have an understanding that if they report their symptoms that they might be held out. By having someone who's qualified, like an athletic trainer there, they have the ability to look past what's being reported and the history that's being reported and actually look at some physical symptoms and see what's going on with the athlete. So having an athletic trainer there to look past what the person is saying or what they're reporting, and the belief that one has to be knocked out to be concussed, or the misconception of a coach of a similar thing, is very key in early management and proper care.
What's the risk of an athlete that's concussed continuing to play?
Well, that's a hard question to answer, I think, specifically. The risk to them long term is we don't know right now. But our fear is, especially with some of the latest things that have come out in NFL, our fear is that there is long-term consequences. And long-term consequences in the brain is a significant problem. So there's a lot of current research that's going on right now to try to understand what those long-term consequences are. But we fully don't know those things. So we're trying to do things to protect the athlete, because I think we would all say it's better safe in finding out that these things were insignificant than we find out that, yes, they are very significant and we didn't do anything to protect those individuals who are participating.
Now, let's say an athlete sustains a hit and is suspected of having a concussion. You were formerly the head trainer here at UNC Charlotte. Take me through the evaluation process. What are you looking for when someone's suspected of having a concussion?
Well, currently what we try to do is do what's called a sideline assessment of concussion. So what we want to do is find out about, first of all, cognitive function. We want to find out, is the person oriented to place and time and where they're at and what's going on. So we'll ask a series of questions about what's happened in that day, where they're at, things that have been done and said in recent time. So we want to find out if they're oriented and if they have cognitive function. And then we're going to do a series of things to stress them a little bit. For example, balance is often affected with concussion, so we'll do things like a balance error scoring test, where we'll put them on a little foam pad and have them do some single and double leg standing. We'll do some trail watching with our hands, so that we want to see if they focus and can follow our fingers.
The old stereotypical, how many fingers am I holding up?
Yeah, although it's not necessarily how
Right.
many fingers, it's really more of a movement to see what happens with the eyes when the hands move, to see what occurs. So it's a series of cognitive testing, eye tracking, and balance-related testing. Now, we all have to do that in a short period of time. That's the challenge of being in practice, or especially a game, that time is a little bit of a factor. So we can't do what would take us an hour in the clinic to test an athlete. We have a limited period of time. So we have to do that and make a decision and make that test simple enough to do that we can do it in a short enough period of time that we can get a reasonable answer to whether they are concussed or not.
And that leads me nicely into my next question. I was curious how that charged environment, it has to be a little bit difficult, more difficult diagnostically to operate there. How are future athletic trainers educated on dealing with that?
It is difficult. A couple of things that have happened that have made it better. As we've educated coaches and parents and athletes about the significance of concussion, we see more and more coaches who are accepting of the fact that this is a significant problem. And so there is less pressure to return the athlete to play quickly. If we look back 30 years ago when we thought it was a ding, the coach wanted the athlete returned quickly. You know, if we told them they hurt their knee, they'd say, all right, tell me when they can play. If we say they hurt their head, can they return now? So the culture has changed just a little bit, and by the culture changing, that's made our life a little bit easier. So as coaches understand that a concussion is significant and a player understands, I think there's a little bit less pressure. And also having guidelines and rules to begin with, so that if everybody understands up front what happens when one is concussed, then it makes the procedure a lot easier. If nobody understands, or the coaches don't understand, the players don't understand, then that's when there's greater pressure to put the athlete in play. Certainly we do a better job of returning athletes now than we did 20 years ago, or even 10 years ago.
I've seen in the literature some remarks about the complexity of this diagnosis regardless of the environment. What makes it so challenging?
The real thing that makes it challenging is that not everybody responds equally. So if we take the same hit on two different people, let's say we can put sensors in helmets, and we have person A receive a hit on their helmet with a certain force, and we have person B receive that same hit with a certain force. We may not end up with a concussion in one, and we may end up with a concussion in the other. And what appears early on like a more significant concussion in one person may resolve quicker, and the person who seems to have a less significant problem may have prolonged recovery. So it's complex. We like to categorize things and we like to nail things down. It makes it difficult to categorize a concussion. It makes it difficult to nail it down and say, if you had X, Y, and Z, if you had these symptoms, these symptoms, these symptoms, you have a grade 1. And if you had this symptom and this symptom, you have a grade 2. We simply can't nail it down that way. The other thing that makes it difficult is there are no tests for it. There are no exams that you can do. You can't send somebody to the ER and say, let's run an MRI, or let's run a CAT scan, or let's do some blood work and make a definitive diagnosis. So it's really a diagnosis that's based on expert opinion, right. And then how significant it is, you don't really find that out until the conclusion of it. At the end, then you can go back and say, okay, we think this was the level of the concussion that they had. But early on the front end, you can't make that assessment.
Could you explain the idea of baseline testing and how that might make diagnosis a little bit easier?
Sure. So what baseline testing does is we try to do some neurocognitive tests and some balance tests and a series of tests on the athlete to create where they are from a neurocognitive standpoint and also from a balance standpoint. So all those things that we're going to evaluate post-concussion, we want to evaluate pre-concussion so we know where they stand before the concussion occurs. There are a little bit of problems with that, especially with the younger athlete. For example, an athlete who has a neurocognitive exam done as a freshman, as they grow and mature and their brain grows and mature, we all know that they change. And so a year later, we may see a totally different neurocognitive test. So one of the things that has to happen in the younger athlete is that we need to do these baseline testing more frequently, probably, whereas in the older athlete, probably that baseline test can hold for a longer period of time. But still, those things we're trying to get a grasp on those and try to understand, how frequently should we do those things. But baseline certainly helps us, if the baseline is true. Right. One of the things we found with competitive athletes is that, and we try to get away from this, is their ability or their want and their desire to game the system. If they know that baseline, that their evaluation of normal will be based on their baseline or returning to baseline. There is the thought that maybe we don't want to show up with baseline being so good to begin with, right, so that I can return to play quicker. most of the tests have, and if you're an expert in running those tests, they have enough subtlety to them that you can figure out when somebody's trying to game the system. So.
Now, post-concussion, could you give us a snapshot of the general treatment procedure? I know rest is obviously probably number one, but what else can be done?
Well, one of the things we want to do is what's called a graduated return to play protocol. So we're going to remove them from activity. They certainly aren't going to return to play if they are diagnosed with a concussion the day of the game or the day of the practice. So what we want to do, first of all, is get them to normal in daily living so that they don't have any symptoms. So neurocognitive testing returns to normal and they have no concussion symptoms such as headache or feeling like they're in fog and an inability to concentrate. So the first thing is rest. We respond to a lot of things with rest. The body heals really well if just given some time to rest. So our first thing to do is give them some rest and allow them to return to, quote, normal and daily function. And then once they return to normal and daily function, then we start graduated activity. It may be that once they return to normal daily function that we put them on an exercise bike for 30 minutes. And if they get on an exercise bike for 30 minutes and their symptoms don't resolve, then 24 hours later we'll increase their activity. If we put them on an exercise bike for 30 minutes and their symptoms do return, then we know that they're not ready to begin exercise again. Another thing that's going on in trying to return them back to normal is trying to reduce not only physical stress but cognitive stress as well. And this has become a little bit of a challenge if you have the school-age athlete, whether that be middle school, high school, or college. They have academic requirements, which the brain has to work and function, hopefully, to do that. So they need cognitive rest, which means we may have to ask for accommodation for that individual. We may ask for them to have instructions in writing or listen to lectures in writing so it doesn't tax the brain quite so much. We also want rest socially for that athlete. So many athletes spend a lot of time playing games or looking at a computer and watching television. So what we want them to do is remove themselves from those activities for a period of time. Not totally. We don't want to put them in a dark room for 5 days because depression can come along with those things. What we want them to do is just rest their brain a little bit, take away the activities that tax it so it does get the chance to recover. And sometimes that's difficult as well, to try to get the athlete to stop engaging with the social activities that they're involved with.
An urban myth that I think still persists surrounding concussions is the idea that after someone has a concussion, you can't let them sleep for an extended period of time. You need to wake them up every hour. That's not necessarily true though, right?
It is not. If you've evaluated the athlete and you feel that it's a concussion and there's not danger of them having a more significant brain injury, if there's nothing indicative in your examination that they would have a more significant brain injury, then what they need is rest. So if you have someone who's concussed and you're waking them up every 2 hours in the middle of the night to sit up and talk and engage in a conversation for half an hour, you're certainly not allowing their brain to rest. So one of the things that we've said is that for the most part, if we feel that there's no worry of a deeper brain injury, that there's not really a need to wake that person up constantly throughout the night. Let them rest and let their brain recover and rest.
You'll occasionally see lawsuits in the news about the way an athlete's concussion treatment was handled. Are the legal ramifications something that trainers need to be wary of in their treatment?
Sure. One of the difficult things is, we mentioned about protocols in the past. One of the difficult things in the past for the athletic trainer is coming up with what we would call standard of care, or standard treatment, when there was no standard of care or standard of treatment. Now what the athletic trainer needs to be cognizant of and be aware of is that there are standards and there are protocols, and they need to meet those standards and follow those protocols. And if they do such, then they should have less fear of litigation. So if the NCAA mandates that baseline testing be conducted and that the athlete must be held out for X number of days before they return, the athletic trainer should be aware of that and make sure that they're following those rules and guidelines. And if they follow the rules and guidelines, then their fear should be a lot less. If they're not following the rules and guidelines, then they should significantly be worried. In North Carolina, we haven't touched on this, there's the Gefeller-Waller Act, which says that if you are concussed, that you have a specific protocol that must be followed. And this is really good for the high school athletes, so they can't return to activity without following that protocol. So by mandating that, we have a better chance of ensuring that there aren't any bad outcomes with these
And
concussed
as you said,
athletes.
that makes it a little easier on the trainers at the school level to know what the standard protocol should be.
Right. These are the rules, these are the forms, these are the papers. If someone's concussed, you have to fill out these forms. The athlete has to see a physician. And by following these protocols, the athlete should have a lot less fear about being sued. Obviously, we could be sued for sure. But if we follow the standards, then we should be not worried about doing our job if we're following the standards of care.
Now, certainly, we can't talk about concussions in America without talking about football, as popularization or public attention to what's been happening in the NFL has been driving this discussion. Is it possible to significantly reduce or even eliminate concussions with the way the game of football is played?
Well, that's a big question. And I think everybody's working to figure that out. One thing we do know, it's not possible to eliminate them. Based on our current knowledge and our current belief and the way games are played and the way life is lived, we're not going to reduce concussion to zero. So we're not going to find some miracle cure or prevention method that's going to reduce them to zero. So what our goal has to be is to reduce them to levels that are acceptable, prevent those concussions that don't need to occur, and manage those concussions effectively so that individuals return to daily living and to their sport without long-term ramification. So short answer is that we can't get them to zero, but we can prevent some of them, and we can make return to normal better. I don't know if that's a correct way of saying it, but we can. Our goal should be better management, I would say.
Now, connecting back to education, is that part of the effort too, making sure that especially parents of younger athletes are fully aware of the risks of playing any sport, I mean, including football and soccer, any other popular sport?
I think we, as a society, need to do a better job of educating our youth athletes about especially sports that have contact and have collision. Certainly, if you're playing youth football or youth hockey, there is potential for concussion, but also other youth sports as well. Youth soccer has the potential, and youth lacrosse has the potential. I think one of the things we have to do as athletic trainers and as a society is to inform parents of the dangers of participating in sport, not just concussion, but all potential things. And I think it's a very good thing to have a meeting if you're running a youth soccer team at the beginning of the year when you have your parent meeting to talk about not only your goals for the team and what you want to accomplish and your coaching philosophy, but to talk about things like safety. There are certainly the CDC puts out things, a heads up training program for coaches and for parents. So as we point those parents and coaches to those things, I think they'll have a better understanding of what the potentials are for injury.
Turning back to football specifically, some have invoked improving helmet design as the potential remedy for some of the concussion concerns we've been seeing. What legitimacy is there to that? How big a difference can helmets make?
Well, long term, I don't think we haven't found concussions still exist, even though we have football helmets, and the helmet manufacturers are trying to make a better helmet. What the helmets do is protect against significant skull and brain trauma, skull fractures, mostly. I don't think as long as we have collisions that occur where helmets hit helmets, I don't think that we will get them to zero. I don't think the data shows that concussions have been reduced by helmet design. Now that doesn't mean that they can't be reduced, but right now with the current way that helmets are designed and the way that games are played, I don't think helmet redesign by itself will change much. There's many more things we'll have to do other than just helmet redesign. And there are things that, they've tried to redesign face masks and their attachment points, and they're designing how the pads contact the individual's head. But for the most part, helmets in their interior design haven't changed a whole lot. They've changed subtly, but still you have a hard plastic case with foam padding on the inside that absorbs that force. And there's some manufacturers that are trying some subtle things to change rotational forces. But right now, they haven't decreased concussions simply by helmet design and helmet change. It'd be great if they would, but right now I don't. And maybe somebody will come with some game changer that we hadn't thought of, but right now I don't see that as being the answer to concussion management.
Several NFL players have been posthumously diagnosed with chronic traumatic encephalopathy, or CTE as it's popularly known, and it's actually been found or suggested that the condition contributed to their deaths in many cases, sometimes through mental disorders. But what can you tell me about this condition and how it relates to repeated or long-term concussions?
One of the things that has started the concussion discussion was that Mike Webster, who was a former football player with the Pittsburgh Steelers, who post his NFL career suffered with depression significantly, and became homeless, had a lot of mental health issues following. After his death, upon autopsy, they had found that they had this accumulation of what's called a tau protein within his brain. And so we created this diagnosis of chronic traumatic encephalopathy. That existed before, but we didn't really have an understanding of CTE and its link to long-term head impact. So our real concern is that we have individuals who may not even be diagnosed with concussions, who are making head impact on a daily basis over a career, and that this long-term head impact over a career is causing this CTE. That's a real unknown. We have a very small number of athletes that we've looked at to find out whether there is a true link or not. However, those athletes are fairly big-name athletes, and when we find, for example, like Junior Seau, who commits suicide, and then posthumously we find out that he had CTE, then we start thinking, you know, how many athletes are there out there who have CTE because of this long-term impact? I think for the sport of football, I think that's a real question as much as concussion that we're going to have to deal with is beyond preventing concussion, do we need to find a way to limit non-concussive head impacts? My belief is that yes, we do. We need to find a way to reduce repetitively head-on-head impact.
Before we go, I want to step back and look to the future of athletic training. Can you give me just a quick rundown of UNC Charlotte's athletic training program and some of the opportunities that students have here?
Sure, certainly. So our athletic training undergraduate program is currently a bachelor's level program. We accept typically about 20 students a year into our program, with our goal to be to educate students to be prepared to work at the professional level, at the high school level. And about, I don't know, probably about 25% of our athletic trainers work in what we would consider physical therapy or rehab clinics. So what we try to do is create an atmosphere where we have very good people who are trained in those areas. One change that will probably be happening in the future, our credentialing body has just changed the level of education for athletic training from an undergraduate level to a master's level. So in the future, we'll be educating students at the master's level. So you'll go get an undergraduate degree and a degree of your choice and then apply to our program. And we think that's good for our profession because it'll allow us to have more competencies within athletic training, advance our profession a little bit and our skill set a little bit. So sometime within the next 7 years, our degree level will be changing.
And that's about all the time we have for this week's edition of the Live Wire. For UNC Charlotte Athletic Training Clinical Coordinator Brett Wood, I'm Will City. Tune in next week, same time, same place.